Hi, my name's Leesa and I'm the Country Recruitment Manager here at Flinders University in South Australia. I'm joined today by a very special guest and current student here at Flinders University, Leesa Fernando.
Hi, so I'm Leesa Fernando and I'm a second year clinical science student studying a Doctor of Medicine.
Yes, and you're originally from?
Sri Lanka.
Yes. So Leesa's going to show me a little bit around today because even though I work here, I don't really know this area. So, and also show you, obviously, so you can get a sense of what it's like studying medicine here at Flinders University. So, where are we going to go?
So the library is right there.
Okay,
so
let's go have a look. So have you been in here yet?
Yeah, I have. The library, I spend most of my time here.
Okay, lovely. And you were telling me as well that there's something that you joined, that you do plays and things.
Oh yeah, the med review. That was really fun.
And what do you do with the med review?
It's like it's where you meet a lot of seniors and just have fun.
Okay.
It's a musical.
A musical. Ah, very cool. So we're in the library. Obviously, there's books in the library and journals. And what's over here? In the cabinet.
It's like some equipments, probably old equipments, it's equipments, old stuff. So I guess it's donated stuff.
Okay.
So maybe let's have a look at that.
Yeah, let's have a look. So it's like old medical instruments.
Yeah.
Aha. So interesting. So I have no idea, but it looks like all different things in there. Very interesting. So kind of like a little museum, I guess.
Yeah.
Of all old medical instruments and medicine and I don't know what else. Body parts.
Yeah.
Yeah. So this is just for medicine students?
Yes. And if you're not even a medical student, but for nursing students and anyone
health related.
Yeah.
Health related library here at Flinders University. Hi everyone, we're having a look now at this multi-purpose learning facility here. So this is a space that you can come in if you're already in your Bachelor of Clinical Science, or if you're at the start of your program, or if you're in the MD program or you've progressed to that point. So this is an area that all students use. I'll pass over to Leesa, who has been in here already as part of her clinical science program, and she can explain what she's done in here and some of the features of the room. So come through.
So this is where I came to do some of the pracs that I had to do this year, and one of them were the ECG and the nerve conducting test. So that's what I did here. Also, during the MD program, you have to do your tissue cultures and stuff like that. So this is where you come.
Perfect. And I think behind us here, if we come over here, there's all the laptops in here, which obviously if you're doing something that requires, computers, they can come out and be used in this space. There's also over here in the drawers, there is microscopes. So for any of that sort of work, there's all the microscopes in here that can come out and obviously be on the bench. So I guess the idea of this space is that there's all sorts of things that you can do in here.
Yeah.
And also if there is students studying online, this is being broadcast, so they might do, what's the word? Microscopy. I'm not a medical student, as you can tell, but it can be broadcast. So if our students are in Darwin or anything like that, they can be doing a prac with the microscope here, and it's being televised. So this room is quite amazing in terms of all the technology that's in here. And yeah, just as the name says, being a multi-purpose student facility, it has multiple uses, and you'll do so many different subjects and topics in here. So it just shows you a range of technology and amazing resources that you have as a medical student here at Flinders University. So we're now in the clinical skills simulation lab. So we're going to show you a few little areas in here so you can get a bit of a sense of what you would be learning and doing in this space. So Leesa, tell us about what you've done in here already.
So this is where I came for my communication topic for improved patient health, where we had to wear scrubs and put the stethoscope and see ourselves in front of the mirror to be to feel what it was like to be an actual clinician, and we got to play a little bit of scenarios and stuff here. Yes. So that was pretty fun, and we got to experience what the patient felt like, because we had to get on the bed and reenact the scenario of being in a hospital. So that was pretty fun.
Great. Yeah. So that was in your first year of clinical science?
Oh no, this is in the second year.
In second year.
It's first semester.
First semester. So you just did it last semester?
Yeah.
Okay, excellent. And in this space, so students would sit around and they would have, a mannequin on the bed. They might be having some sort of looking at the one particular part, of what's happening with that scenario, and then they would all be discussing it in this area. So this is one space where you'd work as a group to basically sort of solve a medical issue. So come with us and we'll show you another space in here, in this clinical skills simulation lab. So we'll come in here. This is meant to look like a hospital room. So as you can see, there's a mannequin on the bed. There's also the drawers with all of the different equipment and drugs and syringes and things like that you would see in the hospital. So that's excellent. And then there's a special little room where your clinician or academic goes. So it's a hidden little room. You come in here. It might be a little bit dark, but this is where the academic would control the mannequin, and there's also the microphone so that they can go through the scenario of what's happening with the mannequin out on the bed, so that they're having shortness of breath or something like that. So this is the control panel for the mannequin in the bed, so that the students can practice working with real life patients.
So this room replicates the exact scenario of what an ED looks like, or just the wards, and this would be a main part in the first or second year of MD. So
excellent. It's a great learning environment for students.
Yeah, it's one of my favorite right now.
You're looking forward to doing
Definitely, definitely.
So where are we now, Leesa?
So right now we are at the anatomy lab, which is where the MD students do their dissections, and the anatomy museum is there. So it's pretty cool, and where you learn so much about the anatomy in real life.
Wow.
Yeah.
And I heard that there's gadivers in there.
Oh yeah, I just saw them and it looks pretty cool.
So apparently not all universities use gadivers anymore, but Flinders, we do here at Flinders University. So you will be working on real life bodies that have been donated to the university. So that's quite amazing. We can't show you, obviously, because the bodies have been donated, but I'll take Lisa's word for it that it's pretty amazing. We're in the Anatomy Museum now, So this is an area that you come to when you're into the MD program?
Yeah, I haven't exactly been here before, but it looks really fascinating.
Yeah, so there's all different parts in this area. We can't spend too long showing you because they've all been donated, but yeah, so we can't really identify anything, but at least you can get a bit of a sense of what it's like. And then we're going to show you through, we're going to introduce you to Les, who's going to show us the how do you call it? Anatomage table. So come through and Les will explain about this anatomage. I'm learning lots of words. So now we're going to have a look at the anatomage table. So this is a learning area for students. Usually it's not in this room, usually it's in the main room, but at the moment they're dissecting a body in the main room. There's a group working on a real live cadaver. So we're in here to show you, and we've got Les here who's going to explain what this table is and what it does.
Okay, so this table here is people have donated their body. So these are actually real people that have donated their body, and what they've done is they've done a MRI on them and a CAT scan, and they've also injected the body. So when you do that, and then they slice the body up into slithers, and then the computer puts it all back together. So then we can do stuff like this. So just taking the skin away.
Wow.
So as I keep moving through, it takes structures away bit by bit. So
you can break it down and then build it back up again.
Yep, so I can go either way.
Wow.
So all the way to, so I'm just left with the veins and arteries. And this is a lot of detail again. So if I add more detail, now it's less detail, so it's taking everything away.
Yes.
But if I go the other way, then it just brings in the detail of the nerve system, the lymphatics, veins and arteries.
Wow. And have you been in here, Leesa?
No, I haven't. This is my first time here, and it's so interesting that I can't wait.
So we can do another thing where we can just tap it shows the blood flow, so it's the oxygenated blood coming back into the heart.
Wow.
If you hit an artery, there's the arteries.
So people donated their bodies.
There's the arteries, those red. Yep.
They sliced them, scanned them, and then that's all. There's 4 bodies in here that you can look at all layer by layer.
So the male we've got, he's very muscular, so it shows a lot of muscles.
Yes.
The Korean woman or man, she's very high detail. So if I go to here, so you have a CAT scan.
Oh wow.
So as I move this, this one here, where the plane's going, it shows you where we are on the body.
Oh.
So that's a real live CAT scan.
Wow.
And then to go even further again, I can actually put an MRI in with it as well. So it's
So students would work on this as well as use real life bodies as well. Yeah.
Yes. So they taught how to use it pretty quickly. It's very easy to use. And again, so if I move this here, so there's the MRI, there's a CAT scan, so it all goes in unison with each other.
Wow. A really good learning tool for students here at Flinders.
Yes, and so it's got a lot of features on the table. You can do so we're going through the heart.
Oh wow!
So, and it tells you at the top there, we're in the right ventricle pulmonary valve now.
Right.
But on here it just shows you as well where we actually are.
That's amazing. So I don't know if you can capture this on video, but basically we're getting like a tour of different parts of the body. At the moment we're in the heart, is it?
That's correct, yeah.
Yes. That's as detailed as I can give. That's fantastic. Thank you, Les.
So I can put the body back in again. The other feature we've got too is they can quiz themselves.
Yes.
So if I tap on that, it would tell me what I've just removed. So I've just removed the external oblique.
Right.
So every time I keep touching what I've touched, it will tell me what I've taken away.
Okay. So that would be good for sort of, if you're having to learn what the different...
You can also isolate. So if I tap that, see now it makes it Sorry. So it just emphasises on that part and makes everything else transparent so you can actually see. Very,
Wow. Yeah, that's quite amazing, isn't it?
surgeons can use it so they can do a cut, they can do surgery,
Yeah.
they can practice doing, I've had a couple of surgeons come here try and practice doing removal of the appendix.
Right.
So they open it and so they can see the structures as they go down.
Yeah.
We had a complicated surgery, a surgeon had to come down because the guy had been in a motorbike accident and he severed his brachial plexus, so they had to.
So doctors that are currently
Surgeon.
will come in, a surgeon will come and practice on here first.
Yep.
Wow.
So they'll come in and they'll start taking away, so she can see what structures is actually, so when she's going in to do the operation, she can see what she's actually going through.
Wow.
She said it was a very big help.
Yeah, that's amazing. Excellent.
But it's a good learning tool for the students. So.
Yeah.
We can put this up on we've got 4 screens in there.
Yes.
So we can put this up and everyone trying to hold on this table, everyone
Right.
can see everything up on
Okay.
that. All that. So,
Yeah.
yeah. Eventually we're going to have, we've got 3, so just updating this one and the other one up there.
Yes.
One will be kept in the museum so they can come in any time and use it.
Okay.
This one here will keep teaching,
Yes.
and the other one I think is going to go to the library.
Right.
So when they go to the library they can use it in the library.
Yeah.
So
Fantastic. Excellent. Thank you so much.
that's okay.
So this is how close the hospital is to the uni. So like just right there, that door is where you enter the hospital, and that's where the library is.
So it's a 500-bed hospital right
Yeah.
there, and we're going to show you how close it is to the library. Let's go. And now we're in the library, so you can see the benefit of being a student here, medicine student here at Flinders, because you're so close to the wards. So Leesa, where are we now?
So this is the student common room for medical students, and this is where you just come to like maybe eat lunch or just to relax after a stressful day, and maybe to even study.
Ah, nice. So you can sort of hang out, have your lunch here.
Yeah.
There's fridge. I guess you could play games or whatever
Yeah.
in here. Yeah, so it's a really nice space. And maybe, like, is there any sort of advice or anything experience-wise that you'd want to share with other students that are looking at potentially studying here at Flinders in medicine?
Yeah, I would say that like doing clean sci was like a good thing, because like for 2 years like you can just like ease through uni life and just get settled instead of just like starting MD. So like by then you are already settled and used to Adelaide, and like you have your friends and everything, so you don't have to be like very like exposed to like a new thing, because like you would just ease into MD, which I hope would be the case like next year.
Yeah, so there's 2 years of your Bachelor of Clinical Science.
Yeah.
And you've almost done that. You've got one more semester. And then you do your 4 years of MD. So, yeah, it's a nice little lead in.
Yeah.
Yeah.
And like clean sci, one thing I wish I knew beforehand was that it was just the fundamental of science,
Okay.
and then like MD is full on.
Okay.
Yeah.
So, yeah, it gives you time to make
Exactly.
friends, enjoy student life for that first couple of years while you're doing your Bachelor of Clinical Science,
Yeah.
and then get really heads down.
Exactly. Yeah.
Lisa was saying she doesn't drink coffee, but she thinks maybe next year she'll start.
Oh yeah, and like if you join the Flinders Medical Student Association, I think you get this keychain where you can show it and get discounts for coffee. So that's a
Aw.
good deal.
Yeah, nice.
And even for like tickets and stuff, like the Med Ball and like Med Review tickets and everything, you get discounts for that. So that's good.
so lots of different sort of discounts and freebies and
Exactly.
benefits of joining the medical club. What is it called?
Medical Society.
Society. So come and join Flinders to do your medicine degree here because it's an amazing program.
It is.
Yes.
Yeah. And like especially the cadavers, like today was the first time that I saw them, and like most unis don't have it. That was like one of the reasons why I came here.
Yeah.
So yeah, and like the anatomage was very interesting to look at.
Yes, yeah, amazing facilities and really that hands-on learning. I loved how you got your own body, your own cadaver
Exactly.
with your own group, and that's where you do all your dissecting and learn, and that's that hands-on experience.
Exactly. Yeah.
So thank you for taking me on the tour of the Flinders Medical Centre and the learning areas that our students will have access to as a medicine student here at Flinders.